adding new work restrictions and frequent medical redetermination rules are being added, which for people who do not speak English will only lead to further decline in the number of people that are enrolled for public benefits. What it will do in the community, from my perspective, is we will probably see more people seeking services in the ER and hospitals, and then they will be turned out after a short period of time and will have no room to go to any places because a lot of CBOs rely on Medi-Cal in order to get reimbursed. On top of that, with the Medi-Cal, we have workforce development shortage in mental health. So with fear, confusion, shortage of providers, people who are speaking monolingual, not familiar with English, not using English as their first language, there is just a general sense of hopelessness. And with that, I can pass it on to you.
Thank you so much. Hi everyone, I'm Rovina Nibalkar. I'm the Executive Director at NAMI, Santa Clara County. If you don't know what NAMI has been doing advocacy, education and prevention work around mental health for over 50 years now. So just to add on, I'm going to say this. We all know about how much stigma is there around mental health. Now, when we have a physical illness, we go seek services and then we're given a medication, we're given a protocol, we're given a plan. The first thing is for mental health, it's very hard for individuals and families to seek services. That itself is a barrier. Now, when you add on issues like when there is lack of insurance coverage, when the insurance prices are really rising up, that adds on an added layer to how families and individuals can go out and sort services. In our communities, language barriers, transportation, immigration issues, those are already so many issues that we are dealing with. Now there's another layer that we add on to it. Mental health is never treated the same as physical health. With physical health, we all have awareness and we know we want to take a medication. With mental health, you need not only medication and a therapist, but you need an entire system to support you. So with that, I'm going to pass it on.
Thank you. First, let's give a round of applause to these extraordinary leaders who are on the front line. I see Yogi Chog and Viru and Padmaja just came into it, also great community leaders in our district. Elaine said something very important, and I want to make this very clear. The big ugly bill, that's how I refer to HR 1, basically gave tax breaks to the billionaires to take away Medicaid and Medi-Cal from Californians and people around the country. And it's taking away the Obamacare subsidies. That means 2 million of our fellow Californians are losing their health care. And there is an initiative in California that says that the billionaires, of which there are 250 in California, 250, any from here? All right, you never know. 250 of them, and they own $2.1 trillion. They own half of our economy in California. We have a $4 trillion economy. These 250 people own $2.1 trillion. And there's an initiative that says that they should be taxed 5% one time so that 2 million Californians don't lose their health care. And I have supported this initiative. And they say, well, you're from Silicon Valley, your district disagrees with you. Now, I want to just take a poll. How many people here think that these billionaires, 250 billionaires, you won't offend me if you disagree, how many people think these 250 billionaires should pay a 5% tax on their wealth so that 2 million Californians can get health care? Raise your hand. So what's that? How many people disagree with it? So when your hand up, you would support this. I'm holding you to it. The point is that they're making 10% at least in the stock market. And if they're worth 19 billion instead of 20 billion people have health care, that's the social contract. And so it's really important for us to understand that this social contract is broken. I'm tired of tax breaks for the wealthiest Americans on the backs of working class and middle class Americans. We need to reverse that.
I'm going to continue comments here. So you are already subsidizing healthcare for the business practices of our billionaires, of our corporate shareholders. And what I mean by that, beyond the tax breaks, is that when you get a job at Walmart, or a job at Target, or a job at a McDonald's, right? The minimum wage does not cover, and minimum wage was invented a long time ago to say, if you make at least this much, you can have a roof over your head. It may not be a big roof, but it'll be a roof. You will have food to feed your family. You may not be fine dining, but it'll be food. And you'll be able to live. That was why minimum wage was created. That's not what it is today. Now, when you get a job at these places, they tell you, your colleagues will tell you, your peers will tell you, we will tell you at the county, looking at your income, you qualify for Medi-Cal. You qualify for CalFresh, for food stamps. You qualify for housing support. All that is what you all, everybody in this room, has paid into to support the Commonwealth, to support the social contract. So if this is baked into someone's business model, that's not okay. That's not okay. You number crunchers, you brilliant people who know how to look at numbers and sheets and dollars and have dividends and profit, record level profits happening right now at the same time as record level poverty. Those two can't mix together. But I wanted to continue that thought too. That's
an excellent point. We're subsidizing their wages, basically.
We're subsidizing wages and business practices right now. And the thing is that I haven't seen the prices of my shopping trips, my goods, go down. The trickle-down theory of economy has not materialized itself for me and for the family. So I want to also share a little bit about the county, how we are handling HR 1 cuts. So just to keep in mind that I know most people don't think about the county often. That's okay. That's actually a good thing. If you're not familiar with county services, if you've never availed yourself of county services, there's one of two reasons for that. One good reason and one bad reason. One is that you've never needed us. We are defined in the Welfare and Institutions Code as the only branch of government whose sole existence is to keep the safety net. We serve poor people, we serve the vulnerable, we serve foster kids, we serve seniors without any aid or independence assistance, right? That's our job, that's why we are created. So when people say, oh, you counties are bleeding hearts, I was like, that's kind of why we were made. We were built that way. So number one, you never needed our services. Number two, you needed our services and we didn't do a good job of outreaching, right? So that's a really bad problem. So a big shout out to my language access unit from the county for being here to provide language access. And a huge shout out to our community service providers, because when patients don't trust government, when communities don't trust government, our service providers on the ground level with culture, competency, empathy, and relationships step in to save the day. So that's what we do at the county right now. Heading into budget season on May 1st, we were facing a $787 million deficit. Okay, I'll be very honest and transparent. About $200 million of that deficit is our structural deficit. It's something that we face every single year, and we're able to close that gap every single year. The rest of it, the 500 plus million, that came from courtesy of HR 1. HR 1 gave us that deficit. And then by May 14th, with the governor's state revised budget, that added another $200 million on top of the $787 million deficit. So we're at $987 million of a deficit, an artificial crisis created by the big ugly bill. That never had to happen. We could have been okay. And now with our behavioral health services on top of that, on top of the deficit, state funding realignment with Proposition 1 is taking money from behavioral health services away from counties and back to the state. So that's more money away from our counties. Medi-Cal volatility with the redetermination requirements, with and there's new rules. We still don't know the full gamut of all the rules, all the requirements, but let me just talk about redetermination for a brief moment here, is that redetermination, you have to prove that you're worthy of health care. You have to prove that you're poor enough to receive care from the county, and you have to do that every 6 months. You have to do that
with if you have limited resources, limited English, limited capacity. Now, there's a long list of exceptions. There's a long list of exceptions. But the federal government has not allowed us to even exercise those exceptions. If you are deeply disabled and you're not working, you haven't worked, you're deeply disabled, you have a severe behavioral health diagnosis that has prevented you from working for the last 10 years, if you're elderly and incapacitated in that way, right? Those are the exceptions, but we haven't gone the full list of exceptions. We haven't even been given the way to file these exceptions. And for our county, Santa Clara County, we're working as hard as we can to pivot and respond to these changes in the landscape. But I'm part of a coalition of 28 urban counties across the state of California, the Urban Counties Caucus. They're half the size or 1/3 the size of Santa Clara County. They never staffed up in a way to do this level of redetermination because it hasn't been expected of us before. So we've been staffing people in a very different way. These smaller counties are saying, we have no way of doubling our staff with these combined cuts to respond to this new way of Medi-Cal management. And when those smaller counties that all orbit around Santa Clara County shuts down, there are folks that are gonna come our way. They're gonna come our way, and I'm not even mad about that. What I'm mad about is that they're not gonna make it in time. When you need an emergency room, when you need acute care, you need it. Every second counts. And if you can't make it in time to life-saving care, what's gonna happen? So this is gonna be blood on someone's hands at the end of the day. It's gonna be, I'm laying this up if you have this federal administration. I just wanna say that. And it sounds like a downer. There is some hope on the horizon. I hope we can talk about that. But the stuff I'm saying about the state and the federal government, Congressman Khanna, Assemblymember Lee, they have been at the front lines in their respective jurisdictions and their houses fighting tooth and nail to preserve these services, not just for Santa Clara County, but for all counties across the board. And this is impacting counties across the country.
So Congressman Khanna and Supervisor Zhuang gave a really good overview of how HR 1, the big BS bill, really hits Californians, as well as Georgia, Alabama, Texas, Florida, Oregon, California. We all are going to be hit just as bad. And so I want to just give kind of like very 50,000-foot overview. HR 1, basically what it did to California is a couple things. It made our billionaires pay less taxes, and it defunded social safety nets at the same time to pay for that. That was the fundamental contract. In fact, it should really piss you off, as it does, because I sit on the budget committee and I got to make the budget work out by the end of the month, is that we are also under HR 1 as Californians tasked with paying more for less level of service now. Because the federal government used to pay for basically, let's just call it administrative overhead, okay? They used to pay for administrative overhead that every state used, and they said, now, no, the states, you have to pay more of your share now. So we are paying literally more money to administer the programs that are kicking off more people at the same time. So you're paying more for less, and simultaneously, they have created, and Supervisor was talking about this, is they created basically a death by bureaucracy and paperwork for most low-income people. At least 1 in 3 people in California live in poverty. And now if you access food benefits or Medi-Cal, you have to go through a new litany of paperwork to prove that you are disabled, prove that you are elderly, prove that you do have children. And the reality is, as we've seen this in states like Georgia, is that when they implement paperwork things, they're just saying, you know, the Republican cover is, oh, we don't want these people who are 40 years old and live in their mom's basement getting free health care. But the reality is you are hurting the most fundamentally struggling families possible. Think about how frustrating it is for you to fill out any IRS paperwork or DMV paperwork. Now try to do that while you are living just at the poverty line, got 3 kids, you gotta take everyone to school, and you have to do that constantly just to prove that you exist, and prove that you're poor. And we saw in Georgia that basically eliminated 75% of people on Medi-Cal. Or so not Medi-Cal there, but it's called Medicare over there, or whatever the Georgian version is. But they eliminated people from the rolls, and that is the point. And some of the worst cuts in HR 1 don't take effect until 2028, after the election, so that they can reap the rewards of things aren't so bad, they can blame someone else later. And so that's really what's happening in California. And unfortunately, it is causing a lot of tension between the counties and the state, where it's true, as the Supervisor said, the governor's budget has a lot of bad things in it, frankly, that we're fighting against right now that actually worsen things of HR 1, like making it so that almost strengthening those work requirements and having to make people prove they're poor as well on top of those things. Those are all things in the assembly that we're trying to fight against. And there is a certain line item that basically puts the county at further debt, and we are also trying to fight against those things too. Because so there is a lot of this perverse incentive right now where the state needs to pass a balanced budget, the federal government never needs to pass a balanced budget, but we have to pass a balanced budget. And so they're passing on all those costs onto Californians. And I also want to remind people that if you or a loved one aren't on Medi-Cal, it still affects you because the entire healthcare system is like a Jenga tower at this point. So if you take out 30% of your patients who are Medi-Cal, that means your service, your providers, all these things, your hospitals are going to be hit all the same, even if you're on private insurance. And at the legislature level, and we're still fighting with the governor on this, I'm really glad that Supervisor talked about the moral imperative that exists when companies like Walmart purposely undercompensate their employees and tell their employees, this is how you apply for food benefits and this is how you apply for Medi-Cal, because we aren't going to pay you that. We are trying to create and levy a penalty fee on corporations that purposely underpay those employees, so that we have one more source of revenue for Medi-Cal and for patients across our system, because Colorado did it, Massachusetts did it, so we're trying to follow their lead in this way. And at the same time, as Congressman Congo talked about too, is I really appreciate that he was one of the first electeds, in fact, to go out and talk about how it's unjust that California billionaires aren't paying even a modest amount of taxes, and he has been hit relentlessly by the billionaires because they would rather spend 10%, they'd rather spend 2% of their net wealth to not pay 5% of their net wealth in taxes. Even though I was the author of a similar measure multiple years at a time, Rokana is of course much more famous than me, so they take their anger out on him, even though I was kind of the one pushing it along secretly. But so he's been really great at championing this, but it is an unjust where we have two different systems, right? A justice system where if you're rich, you get off scot-free. If you're rich, you can have the best healthcare possible. But if you're the 99.9%, you're stuck in the system that is completely destroyed right now. So at the big picture level, HR1 is completely gutting it. At the state and the county level, we're trying to maximize our resources that we have. We're trying to be creative at serving more people, and that's going to take a lot of willpower and a lot of resources, but I do think we can. Like the example that I showed you about penalizing Walmart and other corporations that purposely undercompensate their employees, there are solutions out there that we can do, and if the president and this ruling Congress can't get their act together to serve people who are on healthcare and Medi-Cal that affects red districts, blue districts, and red states and blue states all alike, then we need to step up as a state and show other states what is very much still possible. Yeah.
Excellent from our Assemblymember Supervisor. I'm going to ask two more questions of our frontline leaders, and then we're going to open it up for conversation to the audience and questions. And you can chime in on these questions as well, Assemblymember Supervisor. So one question I had is that young people, particularly in the Asian American community, are facing more mental health challenges. I hear this when I go to the schools. Why do you think that is? Has the access to mental health services improved for young people and more generally for the Asian American community?
Young people, one good thing I would say is that young people have become a lot more vocal, expressing their mental health issues recently. So that's something that I really want to give in. What's happening is that there's still a lot of stigma surrounded by their parents, and they don't want to talk about their mental health journey, they don't want to talk about their mental health. There is also some impact of AI, which is now a lot of young people are getting dependent on the support that they're getting from AI, which is not correct. I feel like there is, although young people are talking about their mental health, there should be open conversations among the family members. Just want to add on that at NAMI, we do have a program called Ending the Silence, where we work on early intervention and prevention work and education, where we want to be able to talk to middle and high school students about what the signs and symptoms of early depression or mental health looks like. But we also had these similar presentations for their parents as well as the school staff. So I'm just...
Thank you. For young people, I think they, within the AANHPI communities, in spite of this growing awareness, there's still a lot more need for open communication. I think at the family dinner table, you know, if the child is suffering from any type of mental illness, it's still seen as a big shame to talk about and to accept mental health challenges. So the stigma continues, and research continues to show that the children, youth from this community, the biggest fear, the biggest stressor is their own internal need to succeed and achieve, followed by the fear of bringing shame to the family, followed by this peer pressure and everything else that follows around youth and children from the community. So when we hear about when we hear about this racism or anti-Asian perspectives, it adds to the challenge that had already existed from before, which is about admitting or getting help for mental health. So we have to work on all those angles. First of all, normalizing this within our own families and friends. When we learn about our friends and families suffering from mental illness, to get them connected to the supports around them. We also have need for, for example, our community health workers. That's a new initiative, thanks to Congressman Ro Khanna here. These people with lived experiences go out in the community and are able to support people this way and connect them back to CBOs like us. Because there was a lack of mental health professionals in the community. Any movement that allows us to get closer and more directly engage our community members will be helpful. So we need to do more of that type of work at schools, in our local communities, in the clinics, health centers, at our CBOs. We need to bring more people that can understand the local community in the language they speak, and there's still a shortage of that.
Thank you, Congressman, the question. So I think thank you, and I want to mention the family is very important role in the children's raise the part. So I know we also NAMI also had the NAMI basic class, right? And also for free for the family to learn more of the skill with them to how to open to discuss the mental illness with the young generation based on the mental health challenge. And also our warm line also receive a lot of call still during the hate crime recent in the COVID period. So I think, and also because it's our Asian culture, we still want to feel the welcome in this country. So build up the constant the confidence in our young generation is very important. And the other hand, and as the policymaker, I remember the AB 2022. Is proposed by Assembly Hansen Chu, and also is for the consultant in the school, high school, college. It's very important to help them to get the professional support. Thank you.
Thank you for the question. When I think about youth mental health, I think we know that it is rising and it's very documented in different surveys.
We know that youth mental health needs are really at a high, and it's been increasing. And when I think about, and I echo everything that my colleagues here have been saying around the different contributing reasons why that may be happening, from school pressures, self-involved pressures, or some kind of internal pressures. And I also think about the person in their environment. So different ways that everything around a child. So schools, family stress that might be happening, the economy, different parental stress that might be coming, and also like peer stress and what we have out in like social media, what we think ideal might look like, and how does that person feel in comparison to that. So I think there's a lot of different pressures that are happening that are really increasing the need for youth mental health needs. One of the things I am thinking about also about how do we support our youth. And so one of the things that I think a lot of our schools might have, and in San Francisco we have as well, is we have behavioral health counselors or mental health counselors that are on site at schools. And this really helps with really the access of care and really trying to hit those at a prevention level. So before it gets really escalated, because oftentimes by the time someone calls us at RAMS, it's pretty escalated. It can be pretty escalated. And so how can we do that? How can we support someone where it's very low barrier? So we might have, like in San Francisco, in some of our schools, we may have a wellness center, a room very dedicated, or an office space that's very dedicated for students to just kind of come in, walk in through the door, and we also, there's a nursing staff there from the Department of Public Health, and maybe someone might come in for a stomach ache or a headache, or they're not feeling well, and then once we start talking to them, maybe they can talk to someone around behavioral health challenges or mental health challenges, and that's where our counselor can be readily available to have those early touches and kind of build a relationship. And then our counselors are also out in is really part of the school community where we become a familiar face. So I think those are different levers in which we can support our youth early on and also be there when there is a crisis, if there is a crisis that happens.
Just very briefly, I want to note 3 bills that passed out of the Assembly just last week that are of note to youth, mental health as well. So one is that we just passed a bill to restrict addictive algorithmic social media and feeds for anyone 16 and under. This will have huge ripple effects. For adults as well. It's not just about saying kids under 16 can't use social media. We're about tackling the addictive doom scrolling, that kind of addictive algorithm feel. So that is a huge effort that we finally got out of the Assembly that Big Tech was very, very against. Another thing is we're highly regulating AI chatbots. So increasingly, I'm sure you've seen stories of young people and adults who go to AI chatbots as comfort, sometimes frankly companions, not just therapists, and some of those companions can lead them down to perhaps suggesting they should take their own life to be with them. And so we're really, really cracking down on AI chatbots that provide that kind of artificial comfort that's not real therapy in any sense. And the third bill is that we also passed, we're restoring the option of press 3 on when you call 988. That is the LGBTQ youth suicide crisis hotline. And unfortunately, we had to restore that because the Trump administration deleted that, and that is a huge lifeline, especially to LGBTQ youth who are disproportionately adverse of mental health challenges and suicide. So we were able to restore that. So those are bills moving through the Assembly, and should they get all the way signed and everything, those should become law. But those are things you should expect in California to work on: big tech issues, AI, and of course, mental health hotlines, which actually are very, very critical in times of crisis.
Thank you for that, Mr. Mayor. I just want to point out how brave that is, because right now, actively right now, as we go through our budgeting process, the federal government has said, Trump's administration has said, if you use words like LGBTQ, if you use words like DEI, if you refer to women, if you refer to ethnic communities, if you refer to immigrants, it's not in the context of detention and deportation, you will lose your federal funding. That's what's being imposed at the county level right now. When we make our grants, when we make our contracts, if there's any mention in there at all to serve a specific specialized community, we're accused of being in violation of federal administration guidelines. And they say, rip that language out, don't do that service, or you lose all of your federal funding. which they've already got the most out of. So that's really a brave step, and we are taking part in very creative writing at the county right now to make sure that these contracts and services stay in place. I'm gonna add one thing to this conversation here today that, as we're here for an AANHPI month event focused on behavioral health, and this is both for our kids and for our general adult population, is that the model minority myth is still out there, and it's insidious, and it's baked into our governance, right? And how does that materialize itself when AANHPI data is not disaggregated? Wave your hands. Is it motion sensor, or does someone turn off the light? We all sat so still. But when that data is not disaggregated, we don't know the true. Oh yes, lights! I love that. That's like a BTS concert right there. Yes, lights of hope. Feel free to turn on your flashlight. When we don't actually hear or know the story that's being told, right? Like Southeast Asian families in East San Jose are dealing with mental health and behavioral health challenges from a different place, right? From Asian American families from Mountain View or from other parts. This is not a competition of who's more worthy. I'm saying if we want to diagnose the problem, we have to understand its root sources of it, and that there's different stressors in different communities, and that the Asian American, Native Hawaiian, Pacific Islander community does not exist as a monolith. We all get 1 month to share with each other, and often South Asian communities are often overlooked during this month of heritage celebrations too. But we're not a monolith. Each community has its own different immigration journey. They have their own demographic data. They have their own stressors. So for my Southeast Asian families on East Side San Jose, what they're stressed out about really comes back to environment. Can they make rent this month? Right? Are my parents being deported? I know that it's been largely framed as a Latino issue. I hope that the world can see this as a human issue. But my district, District 2, has experienced the highest number of deportations. Half of them are Southeast Asian. Half of them are Vietnamese being deported. And so that's not a narrative what we see out there. So we actually have AANHPI kids right now worried if my dad's gonna go, if my mom's gonna get deported, what's gonna happen? And I can't even begin to imagine. I know the toll that takes on me because I'm responsible for my 400,000 bosses in District 2. But if that's your mom or your dad, and combined with economic security, food accessibility, and the thing is, like in District 2, the demographic data tells us that we're multi-generational households. Some by choice, many out of necessity. So the consequences of space and the lack of resources, that's all that combines to create a perfect storm that is bearing the weight of the world on the shoulders of our youth right now, with very limited access, right? I know our service providers are working tooth and nail, fighting tooth and nail, working round the clock to provide these services. And the thing is that even decision makers, right, beyond our champions like Alex and Ro, is like, do you understand that when we say culturally competent services, we also mean disaggregating AANHPI data to truly understand the root sources of issues, so that we can even have like an actual response, a culturally competent response to that. And I'll just use one very quick example. During the pandemic, when the pandemic and the COVID-19 pandemic was basically destroying the whole world, right? We looked at Santa Clara County data, and the data that fell under the category of Asian, that's all it said, Asian, right? Lowest rate of COVID. And I said, I hope that's the truth, but can we disaggregate the data? At that time, I wasn't a supervisor, I was middle management, right? So all the power of my own bureaucracy. Middleman, I asked for it to be disaggregated. I was told, no, there's no necessity to disaggregate the Asian data. It's what tells us, follow the data. And it was because of our board of supervisors making the demand to disaggregate data that we found out that Vietnamese Americans and Pacific Islanders had amongst the highest COVID infection rates. So then that's when we redirected our outreach, our vaccination sites to also cover, to serve these communities. And that's when we had our community health workers from Pacific Islander communities and Southeast Asian communities to serve, so that we're able to achieve a higher vaccination rate. But I'm just gonna say, look, monolithic data, model minority myth, it actually has like severe consequences that could result in death. And we saw that during COVID-19. And I hope we don't see that in our behavioral health crisis.
Thank you. Thank you to the excellent comments. I want to open it up because I'm mindful of time. So why don't we open it up to questions from the audience? And you can direct it at one of us, or what we can have is not more than two people on the panel answer each question, so we can get to as many questions as possible. Go ahead, Hip.
Congressman, we have Pascal from Sunnyvale. The topic is about AI and post-economy.
Hi everyone, can you hear me? Okay, thank you. So thank you, Congressman and representative, to be here today. Here my question are a little bit. You see firsthand that AI adoption is a runaway train because it gets smarter and cheaper every week. However, we are already seeing tech layoffs replacing workers instead of empowering them. And my question is, how do we transition into this new economic reality where Congress is planning to restructure our economic safety nets, help with the tax frameworks so that automation benefits all citizens rather than just maximizing profit for big technology company and already wealthy stakeholders?
Well, thank you for that question, and anyone else can weigh in. I've said that AI needs to work for working and ordinary people, not just the tech billionaires. And I gave a speech at Stanford where I laid out 7 principles for democratic AI. We're not going to go through all of them, but if you have time, just Google Ro Khanna Stanford AI and you'll see the principles. Let me suggest 2 of those principles. Right now, it's absurd that we tax human workers more than we tax agentic AI. So if you're an employer, you're incentivized by our tax code to lay someone off and replace them with agentic AI. I have said that we need to tax the robots and agentic AI more than we're taxing the human worker. That would be a first step. Second, I've said that you need to have employee representation and bargaining. If a company is going to be adopting AI, they can't just say, okay, too bad, you're out of luck, and lay people off. They need to either find a different position for the employee or figure out how the employee gets trained on the AI, and the employee needs to be involved in the decision on AI adoption. There's 7 principles I lay out, but the bottom line is AI is either going to be in the hands of the tech billionaires or it's going to be hands of the workers, and this is going to be one of the biggest issues of the 21st century.
And just really quickly building off of Congressman Khanna's 7 points, which I was at that speech as well, and you laid out a very good national framework, and honestly, the national government is best to police and regulate AI, so the states now are taking their best stabs at it. So here are a couple things that we are trying to do with AI in California, even though all big corporations constantly try to kill the bills, even though the governor vetoes these bills constantly, is we're trying to make sure that humans ultimately make the decisions about your healthcare, about your employment, or about any other important facet. So even when we do simple bills saying AI should not determine your prescriptions, or AI should not be hiring or firing people, we have so much resistance from big tech and the corporations that we have tried multiple times passing these bills. So as simple as that. And at the same time, we are also exploring what, and this is part of, I believe, with the 7 principles too, what does an AI dividend look like, as it should empower people. But here in the Bay Area, we saw massive layoffs even at Meta, and we're trying to, at the very simple stance of say humans should be in charge, that is still being undermined even at the state level, unfortunately by the governor, even by big tech, so we constantly are fighting on that front too.
AI, I'm going to take a slightly different approach here. AI can be the next latest great divider of the very wealthy and the ever-expanding class of very poor. Or it could be the great equalizer. We're in the early stages of AI proliferation in the world, right? If someone got in on it today, started taking the free workshops at the San Jose Public Library, started doing the long distance learning classes offered by San Jose State. If you even started today, as of today, you're like maybe 2-3 years behind massive proliferation of AI. But in 10 years, in 20 years, in 30 years, the story is going to be told differently that you got in at the ground level. And I'm thinking about I'm thinking about the kids, the communities, marginalized communities, thinking about communities that have historically been left behind during major enhancements or great revolutions in technology and science in the world, right? And that making AI a vehicle to be the great equalizer, creating greater access to its learning, to its usage, to all parts of the community, is going to require state and federal legislation to shape that. It can't be left as the wild, wild west. We're here in Silicon Valley. We've seen what happens when the advancement of technology is left unregulated, untouched, and unmonitored, right? We have catastrophe. So this is a time to lean in. And we get to lean in when our residents, you know how I say I have 400,000 bosses? That's how many people I represent in District 2. Those are all my bosses. When my bosses say lean in, and we're gonna back you up in leaning in, that's what we need to do. So I hope to leave that with you for your consideration, that there is great opportunity here, but it does require shaping and regulation from our state and federal governments.
Okay, other questions so we can get.
The next question is from Mojan from Santa Clara, and it's about elections.
Good afternoon, Congressman Khanna. You frequently present yourself as a champion of ethics, reform, and against political corruption, and have spoken about banning congressional stock trading. Yet reports indicate that your household was involved in approximately 3,900 stock trades, totaling more than $55 million in transactions just last year alone. To many voters, this does not look like reform. It looks like participation in the very system that you claim to oppose. Why should the people of California District 17 trust you on ethics when your action is completely inconsistent and opposite of your rhetoric?
I appreciate the question, and there have been right-wing misinformation attacks, so let me just give the facts. I've led the effort on banning stock trading. I don't trade stocks, my wife doesn't trade stocks. The investments are in a trust that is independently managed and has underperformed the market, and the people who are attacking me on it are MAGA influencers and right-wing trolls who don't like that I stood up against the Epstein class and have stood up against billionaire taxation.
Our first question is from Jonathan Choi from Milpitas regarding mental health care for youth.
Oh, hi, Congressman Brokana. So, a lot of panelists. Oh, yeah. Hi, everyone here from Milpitas. Hi, Assembly Member Lee. Hi, Supervisor. Congressman Khanna, the panelist has talked a lot about youth and mental health. What can the federal, at the federal level, what can you do and also the rest of Congress do to help mental health about youth, because that is an issue in my community, in our community. What legislation are there right now, or what legislation you plan to introduce or support in the future? Thank you.
I'll give the idea, then I want to turn to our frontline leaders to see what they want to see out of federal legislation. But one of the things we need is more professional mental health qualified psychologists, psychiatrists in the schools. It's not enough just to have high school counselors. I love high school counselors. They did a great job for me when I went to public school and helping me figure out where to apply to college. But that does not mean that they can do, just as a counselor, things that are mental health. And we have huge school districts in this country where there is no access to someone who is certified as a mental health psychologist or psychiatrist. And it's one of the places you should have it because there's no stigma. You know, a lot of young people, they may not want to go to a doctor, they may not want to go to a psychologist, but at the school, if they had those resources, then they could get that care, get that attention without having the stigma. So I've supported federal legislation to fund more psychologists, psychiatrists at the schools.
Thank you. Just to add on to what you said, what I would want is somebody who understands the culture as well, speaks the language. In my personal experience, whenever I have sought therapy, I have moved from a therapist to another therapist because they wouldn't understand my culture, they wouldn't understand my cultural norms. And for youth as well, just to understand the intergenerational trauma, just to understand where the parents come from, what the identity crisis that the youth is going through, the cultural competence is important. In addition to that, funding from the federal level for CBOs like us, because the community trusts organizations like NAMI, AANHPI, and so on, so my colleagues' organizations, the community reaches out to us with that trust. And when we don't have funding, we are not able to provide the language appropriate services, the translation services, and so on.
I agree to everything that you both said. The cultural competency part of it, along with trauma-informed care, is really highly needed at schools and at clinics, also at colleges, where generally young people will, get together naturally. Before they go out seeking mental health support, I think the normalizing part of this mental health access to care, where people, they should be able to talk to anyone, their teachers, their school counselors, while we also look at bringing psychologists and psychiatrists that are competent in providing cultural related services. I think language plays a big role, but also addressing stigma at the same time. Even when we bring them to the school, the stigma continues to play a big role and a barrier, and we need to work on all of those, as well as bringing more training and workshop for the parents. The parents play a big role in addressing mental health, because one of the things we are noticing always is about the parents can actually become a barrier for the child, the youth, to receiving services. So we need to address the parents' needs, their migration histories, their unique needs while they are trying to acculturate in America. And we also need to address the first generation, students and children going in. And, all of this requires language abilities to serve, as well as cultural competency to address the unique needs of the families.
Yeah, thank you. I want to echo my colleagues' words, and also thank you so much, because I know as the young generation, sometimes they don't want to speak out, but your guys coming to the City Hall and want to express what you need. We are the model here, the young Assembly Member Alice Lee. So you can bring more young generation to talk to your policymaker. They say what we need, what we just face for, what the question, what the problem, what the challenge. Let them to know that, and they will help you to find some solution. But just our organization also had a mobile app you can use to help this access. But we also need more access, right? And also you are the Asian generation, so just bring more Asian, your young generation to go to talk with our policymaker, to talk to your city mayor or something. Yeah, just let them to know what your guys face to. Thank you so much. Thank you.
Hi, I just wanted to also add that and I think our elected officials are also echoing this too, is that when there is policy put out that prioritizes access to services, that there are also dollars that follow that. So there's funding attached to any type of initiatives that are out there. So like, let's say the youth mental health services that we provide at schools, that there's funding that aligns with that. There's also different systems that can kind of coordinate. So we are a different group that comes into the schools. And so the school system and the community-based organization need to really be very coordinated around that. It could be as straightforward as when we would like to have a counseling session with one of our youth members. The teachers are able to release them from class, let's say. So that kind of collaboration is really helpful. And I also want to talk about our workforce, the providers, the different counselors, the different kinds of counselors that can be of support. So there's, it was said earlier that we are at a shortage of providers, like counselors that are out there who go to school and get the training. There's also different kinds of counselors. So we have a lot of peer providers, peer specialist mental health certificate, certified counselors also. So they go through a 12-week training program and get certified, and they're able to work in many different settings too. So there's all different kinds of support people who are out there, and so we also need to build out that pipeline, that workforce career pipeline.
Sorry to interrupt. I think after this one, we'll have time for one more question on each side.
All right, next we have a question from Cesar from San Jose, and it's about funding.
Congressman, welcome back. I have a fundamental question. Seems like the president can write blank checks for foreign wars, bombs, etc. And yet, just a fraction of what is spent on a day in war in Iran, for example, would solve all these health and social services problems. It's such a fundamental issue. Can you please explain how, the government can president can write blank checks for stupid stuff, but yet, we would save so much time and trouble if just a fraction would be, solved for social services.
I appreciate you raising that. I don't know if you saw or anyone here saw my questioning of Pete Hegseth, but I asked Pete Hegseth, how much did this war cost the American people? And he said it was a gotcha question. It was a gotcha question. He didn't know how much the war in Iran is costing the American people. I'll tell you how much it's costing the American people. It's costing the American people at least $60 billion, which would be enough to fund free public college for every American. It would be enough to have $10 a day child care for every American. It would be enough to fund the full IDEA Act, which would provide the teachers to take care of special needs kids. It'd be enough to fund mental health for every American. And that's not even counting the hundreds of billions of dollars of cost because of increased food prices and increased gas prices. The war has been a disaster for the United States of America. It's one of the greatest blunders of the 21st century. And I believe that that is what the American people, it's why the president's numbers are in the tank. It's why his numbers are approaching George W. Bush. People don't want the foreign wars. And by the way, they don't want us giving aid to Israel as it committed genocide. They don't want that either. They want a foreign policy that's going to stand up for morality and that is going to stand up for investing in the United States. So I share your view, and I will continue to advocate that as a very senior member of the Armed Services Committee. I want to give all the panelists time for a concluding comment. Simone, do we have time for one more question or two more questions?
Yeah, you can use that one.
And then I want, okay, so two more questions, and then every panelist, I want to give a chance for a closing comment.
Hi, Congressman. We got Lawrence from San Jose. He has a question on mental health.
Good afternoon, all of you. Thank you, Congressmember Khanna. Thank you, Supervisor Young, and thank you, Senate Member Lee. As you may know, mental health right now has a lot of impact on a lot of people here, especially in the Bay Area. Sometimes, like, a lot of people have to risk a lot of things to have to take a lot of things to make ends meet. But also not to mention the fact that scams are on the rise, and sometimes when people fall for things, unfortunately, that we don't know, it really hurts people's health. Even I fell for it. and it was not great. So my question to you is that what will you do to ensure that we protect our consumers, we protect constituents from any form of scams, and how do we make sure that people get the help that they need, so that we can all continue to thrive and be able to continue to do our part to ensure that everyone can at least get the help, the care that they need, and be able to be able to at least be assured that they're being well represented, and not be and not that's my question.
Did one of you want to answer?
So regularly I host a senior scam workshop every year, so even if you don't identify as a senior, you're welcome to come to these things. But depending on the scope of the fraud, I definitely would encourage you to report it to authorities, right? If it's something related to your contracts or a house, whether it's a healthcare or it's a bank fraud, these are all different entities, whether it's your local police, the FBI, or our Department of Justice, those are really important things. And I mean, it's no understating that if someone defrauds you out of your life savings, that will cause you a lot of mental stress. So really, I would encourage folks to report them to the relevant authorities depending on the scope of the fraud, too.
Anyone have a comment here?
The district